Hello, and welcome back to our weekly COVID and wellness updates brought to you by Prisma Health Business Health Solutions. I'm Dr. Rachel Brown. I'm the Medical Director of Prevention and Wellness. And we're going to get you all up to date on what's been going on in the last 2 weeks around everything COVID. So let's start from the top. The good news is the percent positive has remained trending around 4.5, 4.6, 4.9 in South Carolina. So a very, very slight uptick in the rate of COVID cases, but nothing like we're seeing in other parts of the country. We do know that there has been an uptick in infections overall in the United States, and it looks like there are more infections due to the COVID variant. So we still need to practice those precautions. We're not out of the woods yet. In fact, I would like to think that the reason South Carolina may be doing so well is because folks are remaining vigilant with wearing masks, being socially distant, and avoiding large gatherings. I will say that almost every county in South Carolina is in that moderate risk range category, so less than 200 COVID infections per 100,000 people. We're still not in the low risk range, but that's very encouraging. We only have Pickens, Greenville, and Dillon counties still in the high risk range. As I mentioned, variants are becoming more of an issue, and I get a lot of questions around this. We're going to talk a little bit about the vaccines and their impact on variants, but I think what we can anticipate due to the variant increase is that, number one, we're still going to need to follow precautions until most of our population is vaccinated, and we feel like we can stop this cycle of spread of either the novel COVID virus or the variants of the virus. But it also means that we'll likely be seeing booster shots. Now, right now, the talk is that this would be a yearly kind of thing, a lot like what we do for flu, where vaccines are tweaked to be most effective against the variants and mutations that we see commonly in a virus. And you've even heard probably some of that mentioned in the media recently. I will say that while the current vaccines are very effective against the variants, they're not as effective as against the novel COVID virus. However, the rate of reported infections, breakthrough infections of COVID due to the variants and people who have been vaccinated still remains extremely low across the country. It's less than 0.0008%. So still incredibly protective once you get the vaccine. Let's talk a little bit about quarantine rules. I've gotten some questions around this. It can be a little bit confusing now that they've added in the layer of what to do if someone's been vaccinated. So remember that folks who've been vaccinated do not have to quarantine any longer if they've been exposed to someone with COVID. They should still practice precautions. They should monitor for symptoms for 14 days, but they no longer have to quarantine, which is wonderful for you and your organizations. That's going to change that entire leave policy that you likely set up in response to exposure management. However, if someone has not been vaccinated and they are exposed to someone with COVID, and remember this means within close contact with a known person who's been diagnosed with COVID for more than a cumulative amount of 15 minutes in that day, that person will need to quarantine. And there are 3 strategies. This has not changed. They can either quarantine for 14 days, which was the original strategy and most effective at preventing spread and outbreaks. They can quarantine for 10 days, a little bit riskier, but still very safe protocol to follow. Or they can quarantine for 7 days, get a COVID test on the 5th day, and if that test is negative, on that 7th day, they're done with their quarantine. This also can be incredibly useful for leave policies and procedures within your organization, because honestly, by the time someone discovers that they've been exposed to someone who's diagnosed with COVID, it's often well already into that 5-day period. They can get that test on day 5, and as long as it's negative, their total quarantine time can be reduced to 7 days. Please remember that if an employee is diagnosed with COVID, is COVID positive, nothing has changed about their isolation period. They still should isolate for 10 days before returning to work. They should be fever-free for at least 24 hours before returning to work, and they should be seeing improvement in their symptoms before returning to work. For folks who do need tests, please know that we have moved away from our mass testing site at Prisma, and testing is now done in our ambulatory care services. So get those folks to touch base with their PCP in order to schedule a test. For folks who do not have a PCP, a primary care physician, we will help them get hooked up with one and have other avenues for getting them the test. And they can check the DHEC site. So I'm going to start sharing my screen now to show you some of these resources. And if we go to the DHEC site, we'll give it a second to pop up. Great. You can see here at the top, find a testing location. When you click on this button, it will eventually direct you to this search page here, and you can scroll down into your location within the state and find a testing site. Most DHEC testing sites are completely free. They have a turnaround time of somewhere around 48 hours. And so this is another avenue if someone does not have a primary care physician. All right, let's talk about vaccines, which is the topic du jour, and certainly the other huge piece of the puzzle in getting ourselves ahead of this pandemic. So right now in South Carolina, I'm going to show our vaccine dashboard, just because I like following these numbers here. You can see that about 38% of our South Carolina residents have gotten at least one vaccine, so have some immunity to COVID-19. 24% have gotten the completed vaccine series. So in other words, if they started with Pfizer or Moderna, they've gotten both of their shots. This is still well under the number that we're looking for, and you can see that this number is not climbing as quickly as it had. Many folks who were interested in getting the vaccine right off the bat have done that, and others who may have been a little bit more on the fence are still waiting to see what's going on with these vaccines, but we really want to try to push this number up as high as possible. The good news is we are doing a little bit better than the national average, which is 24.3% fully vaccinated Americans, 38.1%, 37.3% are partially vaccinated in the US. So we're doing pretty well, although ironically, we still rank 42nd in the percentage of folks across our state who have gotten vaccinated. So there are a few states out there who have had an incredible response to the vaccine that are driving our rank down, even though we're keeping pace with the nation. So if you've got folks who are interested in getting the vaccine, let's talk about what we can do. So as you know, right now we are fully in phase 2. All South Carolinians who are 16 years of age and older can get this vaccine. 16 and 17-year-olds can only get the Pfizer vaccine right now. And in the beginning, when there was a huge push to get the vaccine as fast as you could, the appointments were limited. But now that we're seeing that that wave slow, I can assure you that there are many, many appointments at the Prisma Health mass vaccination sites, as well as the other vaccination sites across the state. So what you can do is also visit the vaccine location here. That's going to take you, let's see if I can find it. Here we go, to this locator. And I've put in a Pickens zip code today just because. And you can see there are, pharmacy chains, retail pharmacies, health departments, DHEC, other medical facilities, outpatient facilities that are giving the vaccines now. So you can check on this page to find out which vaccines they're giving and schedule an appointment. Of course, Prisma Health also has their max vaccination sites continuing to operate. And so if you go to our Prisma Health vaccine page, you can see here how you can register for MyChart, which is our documenting and scheduling technology platform. If you'd rather call, they can set you up with an appointment by calling this number. And they'll send you to our mass vaccination sites at Gamecock Park in Columbia and at the Kmart location in Greenville. Now, I do want to tell you that the Gamecock Park site will be changing to the Colonial Center in the coming weeks. So keep your eye on this page for announcements about operating dates and times and places. All right, other vaccination efforts that Prisma Health is involved in and that you'll likely hear about for our organizations, community partners, businesses that have employees in what we call socially vulnerable areas. So areas where technology is limited, maybe there's not Wi-Fi, transportation is limited, maybe very rural areas with limited access to health care or child care, maybe with organizations that have a lot of shift workers that can't make it to the regular hour vaccination clinics. You'll see the mobile unit, the Prisma Health mobile unit visiting these areas. And Business Health is partnering with the mobile unit in some cases as well to deliver vaccines. So keep an eye out for community events as well, especially if you're in an area that has a high social vulnerability index. That means that your employees have a lot of these challenges to getting the vaccine. You'll also hear about our Toomey pharmacy receiving Moderna, an allocation of Moderna. Now Prisma Health has primarily used the Pfizer vaccine, but we've received 1,000 doses of the Moderna to use in the Sumter area at the Toomey pharmacies. We aren't sure yet whether that's 1,000 folks who can get vaccinated and then we'll get another 1,000 allocation for that second dose, or if 500 folks can get vaccinated and we've got to set aside the second dose allocation. But nevertheless, that does give some options for our for our Sumter folks. And then also Prisma Health is working very hard and diligently at how we can get vaccines into our ambulatory practices so that visiting your primary care physician is a way that you can also get your vaccine. All right, so I'm going to stop sharing my screen for just a moment so that we can talk about what's been in the news outlets over the last week, and that is the Johnson & Johnson vaccine. And so many of you already know that there has been a pause placed on administering the Johnson & Johnson vaccine. This is in order for them to do, the CDC, the FDA, and others, to do a further review of a severe side effect due to clotting and low platelets, which is a very unique combination. This isn't a typical sort of spontaneous clotting situation or folks who have other, say, cancer or malignancies or other illnesses that predispose them to clotting. This is a separate sort of pathway that we're seeing, and it also leads to some very severe consequences due to clotting in the veins of the brain. But what's important to note is that it is extremely rare, very, very rare. So far, only 6 young women have been identified. Unfortunately, there was 1 death and 1 young woman is still in critical condition. However, because the clinical picture seemed to follow some of the evidence that and other circumstances that they had seen in Europe, where there's a slightly higher prevalence of this, they wanted to do the right thing, put a pause on administration, and review what might make sense in terms of next steps. So, of course, they may find more cases as more people step forward and say, yes, I did have the Johnson & Johnson vaccine and I developed a clot in my leg, but we will likely find that this still remains extremely rare. So 6 cases right now out of 6.8 million doses of Johnson & Johnson administered means that this is highly unlikely. However, we should be thrilled that the FDA, the CDC, and others did what they're supposed to do and put a pause on the administration of the vaccine and remained transparent about what was going on in terms of this clotting side effect. That's what we want to see. So while we may have caused more vaccine hesitancy by finding out and talking about this serious side effect, potential side effect, I should say, of the Johnson & Johnson vaccine, we should also take great comfort in the fact that the system is working and it will pause when it needs to take a closer look. And the good news is we haven't seen anything like this with Moderna and Pfizer. And so we have two other vaccines that are extremely effective and remain extremely safe. So that being said, there's going to be an estimated 2-week pause on the Johnson & Johnson vaccine, and what will likely occur after that, say, 2-week period is refined recommendations. Who may not want to get the Johnson & Johnson vaccine? Maybe they decide to recommend that the Johnson & Johnson vaccine be used in older men only. We don't know. We'll see what that review reveals, but this is exactly what we want to happen. I encourage you to continue to support your employees in pursuing getting the Moderna and the Pfizer vaccine, and engaging us if you're finding that hesitancy seems to have increased because of this development with the Johnson & Johnson vaccine. I do want to say one more thing about vaccines, and that is that Pfizer is in the middle of their trial looking at their vaccine in 12 to 15-year-olds. There's been some information, not clear yet, but some hint that they may apply for emergency use authorization by summer, which would mean before the next school year in the fall that 12 to 15-year-olds may be able to get vaccinated. We will keep our fingers crossed and see. So how can Prisma Health help you? We understand that right now there's a lot of frustration among your workforce. We're still having to wear masks. We're still socially distant. We're still concerned when someone gets sick. We're still concerned if we've had an exposure. And we're still trying to figure out how do we get our employees access to the vaccine. So let us help you with that education. I've already had several Zoom calls and other types of calls with employees, with workforces to answer their questions about the vaccines and address some of the concerns they may have, or even just to help them figure out how to schedule their vaccine. We have these videos that you can share with your workforce. Please share the link so that they can get this information and feel better and more empowered to make their decision. And we have plenty of written materials as well, also written in Spanish, if that's a need for your workforce, that answers questions around, side effects with the vaccines. How do I sign up for the vaccine? How long will the vaccine last? What can I expect? If you need help with registration, please let us do that for you. We can help you train up a team of your own folks if you want to have registration fairs so people can get that vaccine. Please bring us your concerns. If they're around transportation, childcare, shift workers, let us know what your barriers are for your employees so that we can help you address them. Let's not forget that this has been a long, tumultuous road due to the vaccine and so many other things going on in our world. So we have been working very hard to buff up our wellness programs and especially our emotional well-being programs. So please reach out to us to find out how we can engage with your workforce around managing stress, building resilience, coping with COVID, and coping with all of the stressors that we're going through right now. And then finally, let us help you get folks hooked up with a primary care provider if they don't already have a medical home. Not only so that they can get the vaccine when the vaccines are in ambulatory care centers, but also so that they have the medical care that they need when they need it. Okay, that's what I have for you this week. We will resume weekly updates. Let me remind you that today is April 16th. So if you're watching this past April 16th, just remember that information changes all the time around COVID. Reach out to us as often as you would like. I will share my screen briefly to show you how to do that. If you go to our Palmetto Health Creating a Safer Workplace page and scroll down, you can share these videos and you can call us. We can schedule a call, we can schedule a meeting, I can answer questions by email, whatever works best for you. Because remember, Business Health is here to take care of you so you can take care of your employees. Have a great week.